They built our nation. They raised our families. But now, for millions of our elders, a simple walk, a morning prayer, or even holding a cup of tea has become a daily battle. This is not just aging. This is arthritis. On this World Arthritis Day, we delve into this silent epidemic sweeping through India's aging population. We will understand it, learn to prevent it, and discover how to live a full life despite it.
In the Indian context, the causes of arthritis are multifaceted. Age and genetics are universal, but we see specific patterns here. The Indian fat pattern, or central obesity, places immense mechanical stress on the knees. Widespread vitamin D deficiency, despite our sunny climate, weakens bones and is linked to both osteoarthritis and rheumatoid arthritis. We are also seeing the effects of lifestyle changes, a shift from active, traditional work to sedentary jobs, which weakens the muscles that protect our joints. The early signs are clear: pain, stiffness, especially in the morning, swelling, or a decreased range of motion. The biggest mistake people make is waiting for the pain to become unbearable. By then, irreversible damage has often occurred.
Prevention is our most powerful tool. It starts with weight management. Every extra kilogram of body weight adds about 4 kilograms of pressure on the knees. Losing even a small amount of weight provides huge relief. Exercise is crucial, but it must be the right kind. We recommend low-impact activities like walking, cycling, and swimming. These strengthen the muscles that act as shock absorbers for the joints without causing more wear and tear.
General practitioners are our first line of defense. They must take every complaint of joint pain seriously, especially in older adults, and not just dismiss it as age. The diagnostic process is straightforward. A good physical examination, simple blood tests for inflammatory markers if we suspect RA, and imaging like X-rays to see the condition of the joint. The cost of delay is immense. Delayed diagnosis leads to irreversible joint damage, the need for more complex and expensive treatments, and a significantly lower quality of life for the patient. Physiotherapy is about empowering the patient. This simple exercise strengthens the quadriceps, the large muscle at the front of the thigh, which helps to stabilize and support the knee joint. For hand arthritis, we teach gentle range of motion exercises, like making a soft fist and then slowly opening the fingers wide. This helps maintain flexibility and reduce stiffness. The do's are crucial. Do stay active within your limits. Do use assistive devices like a cane or brace to offload the joint. Do apply heat or cold packs to manage symptoms. And the don'ts. Don't sit for hours without moving. Don't engage in high-impact jogging or jumping. And don't lift heavy weights improperly. These are simple rules that make a huge difference. For osteoarthritis, medicines manage pain and inflammation. They do not reverse the damage. Success is measured by improved quality of life, allowing a person to stay active and independent. For rheumatoid arthritis, modern medicine is a game changer. DMARDs and biologics can induce remission, allowing patients to live near normal lives. The key is starting early. You feel useless. You see your son helping you put on your shoes, and you remember teaching him how to tie his own laces. There's a frustration, a loss of your role. You fear becoming a burden to the people you love most.
The mental health impact of chronic pain is enormous. It's a constant presence that can lead to frustration, anxiety, and clinical depression. It's vital we address this. There's a huge difference between sympathy and empathy. Sympathy is saying, "Oh, you poor thing." It creates distance. Empathy is saying, "I see this is hard for you. How can I help?" It builds connection. The role of the family is to provide practical help, yes, but more importantly, to provide emotional support, to listen without judgment, to include them in decisions, and to encourage them to remain engaged with life. Community support is the final piece. Accessible parks, senior clubs, and support groups are crucial to combat the loneliness that so often accompanies this disease.
As a geriatrician, we don't just treat the arthritis, we treat the whole person. We manage all coexisting conditions, diabetes, hypertension, and focus on overall functional independence and quality of life. But individual effort is not enough. What can we expect from our system? Arthritis is a formidable challenge, but it is not a life sentence. With knowledge as our weapon, prevention as our shield, and a supportive community as our strength, we can ensure that our elders don't just live longer, but live better, with dignity and joy. The journey begins with awareness. Talk to your parents. Listen to your body. Consult a doctor. This World Arthritis Day, let's take a step together towards an arthritis-aware India.